This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hello, my name is Dr. Rob Page and welcome to Doc Talk. Doc Talk is a podcast that is produced by the Knoxville Academy of Medicine. It features its physician members giving information to patients regarding their health care and to give them information about how they can better their healthcare lives. And in saying that, I have joining me here today Dr. Kyle Kleppe. Dr. Kleppe is a general surgeon here in Knoxville who specializes in what areas do you specialize in?
Yep. So general surgery, minimally invasive surgery, and some of my focus areas are bariatric surgery, surgical endoscopy, so advanced therapies using flexible endoscopy, and hernia surgery.
Wow. So a lot of different specialty areas, but we're here specifically in this episode to talk about reflux.
That's correct.
Reflux, a very common problem. Lots of people have reflux. What can you tell us about reflux?
Well, reflux is a very common problem that many people experience in their lives. And for many people, it's a experience that occurs occasionally after maybe overindulging in some foods. But for some people, this can be a more severe problem that can impact their daily lives and have very significant symptoms, and that can ultimately lead to some very serious disease problems.
So in a majority of cases, we probably can treat our reflux very simply with medications over the counter. But as you mentioned, there are some potential risks for patients who have chronic reflux. And what might some of those risks be?
Yeah. So having reflux, not just acid, but sometimes just the gastric contents themselves coming back up to the esophagus can cause erosion into the esophagus and cause esophagitis. And then chronic irritation over time leads to some permanent damage to the lining of the esophagus, a condition called Barrett's esophagus, and that can ultimately lead to esophageal cancer.
So something that chronically over time can potentially lead to cancer, and something that many of us have and many of us suffer from it. And in fact, what are some of the symptoms that patients can have who have reflux who don't actually feel that burning sensation? Because we know about the classic symptoms, but what are some of the uncommon symptoms of reflux?
Yep. Some of the uncommon symptoms that people experience are cough or hoarseness in their speech, worsening of their asthma, and ultimately some other later signs that people can have are trouble swallowing, or actually be anemic from blood loss due to the erosions in their esophagus.
Wow. So something that that is usually fairly benign but can have potential implications. So in what circumstances, a patient, should I come see you for my reflux, for additional information, possible therapy, or maybe even surgery?
Sure. So I think the biggest thing to seek out medical advice is if you're worried about something, or if you feel like that the symptoms that you're experiencing are impactful in your daily life, and you think that your quality of life is impacted by that. As you said, many people are able to treat their reflux with just some over-the-counter medications, but if that doesn't seem to be doing the trick anymore, then I think evaluation is appropriate. And there's a lot of different workup that can be done in evaluations by many different types of providers, so primary care physicians, gastroenterologists, or surgeons, to look and make sure that everything is okay and that no further intervention is needed. Some things that are not typically treated by medications very well and may warrant surgical interventions specifically are regurgitation of actual food products. No amount of medicine is ever going to help regurgitation. And really we think about why do we have reflux? There's a couple different reasons that people have reflux. One common reason is something called a hiatal hernia. And that's where the valve between the esophagus and the stomach has actually slipped above the diaphragm. the diaphragm is a very important contributor to how well that valve functions in keeping our contents in our stomach and not in our esophagus.
Right.
So sometimes that diaphragm opening is a little bit too large and allows our food to come back up. And that can be evaluated many times with x-rays or with endoscopy.
Gotcha. So, so I'm a patient. I've been evaluated. I have reflux that's significant enough, or perhaps I have a hernia. What sort of options can you offer me surgically? Because the surgeries that you used to have, which were more extensive, are not so much anymore. You do sort of, as you said, minimally invasive surgeries.
That's right. All the surgical therapies that I offer are through a minimally invasive surgical approach. And so that is either with laparoscopy, which is multiple small cuts on the abdomen. We use a camera and small instruments, or even robotic surgery in some instances. And that's just an extra tool that we have to allow faster recovery for many of our patients. So these are sometimes either outpatient surgeries, meaning you come in, have it done, and go home the same day, or just spend one night in the hospital. And the recovery afterwards is generally pretty good.
So, so what's novel about these procedures? I was going to say, as opposed to what they classically used to do for reflux or sort of more traditional surgeries, what were some of the novel approaches that we take nowadays?
Yeah. So the traditional therapy that has been a mainstay for a very long time is something being called the Nissen fundoplication. And that's a procedure where we take the very top of the stomach and we wrap it around the esophagus itself to create a new valve and strengthen that valve such that food products don't come back up, or acid doesn't come back up into the esophagus. And while that procedure has been very successful over the years, there are many people that do experience some undesired side effects related to a Nissen. One of the main side effects is bloating sensation. So if you eat just the way that the stomach is configured, there's some increased stretch on the top of the stomach, and that is uncomfortable for many people after a meal. They also have trouble belching or vomiting if they need to, and sometimes that's a good pop-off valve if you are not feeling well, or if carbonation or things like that you may have consumed. Sometimes you need to let a little of that off, and those people aren't able to do that.
So as opposed to making the valve too loose, actually you can make it too tight, so you're not allowing anything to come back up that really probably should be coming back up.
That's right.
So the Nissen fundoplication, if I can pronounce it correctly, is sort of the traditional approach. Yeah. What do you do that's different in your surgical approach?
Yeah, so we have a couple of new technologies, and I call them new, but they've really been out between 8 and 10 years from FDA approval. One of them is called Links, and I actually have one right in my pocket here. It's a ring of magnetic rare earth magnets that go around the bottom of the esophagus right at that junction, and they stretch and open and allow food to move through, but it provides a little bit more support of that valve when it is loose, and that helps to prevent food products from coming back up. This is applied in the similar surgical fashion as a fundoplication, in that it's minimally invasive, minimally invasively placed, and we also provide hiatal hernia repairs with this as well. As previously, this device and another one that I will talk about in a moment were not previously approved for use in patients with hiatal hernias, and so the application was for a very narrow range of people. And so in the last couple of years, the FDA has cleared these devices to be used in combination with a hiatal hernia repair, so that's really opened this up to a whole lot of other people.
So in addition to the Link system, you mentioned there's another system, and
yes.
What is that?
That procedure is called a TIF, T-I-F, and that's a transoral incisionless fundoplication. And instead of creating this wrap surgically through the abdomen, we actually create it through the mouth using an endoscope. Also historically, this procedure one of the main benefits of it was that you did not have to have a surgical operation on the abdomen in order to have this procedure, and that was traditionally done for people that did not have a hiatal hernia as well. However, the recent updates and approvals with the FDA and a lot of the studies have shown that if we do combine this procedure with a hiatal hernia repair, that we have some really great effects. And we're moving away sometimes from this Nissen fundoplication because of some of those side effects, and people with TIF or LINX are often able to belch or vomit if they need to and have less sensations of bloating.
So not only that, so this would probably also open up the surgery to a larger group of patients because you're not doing as extensive of a surgery. So maybe patients who've had additional surgeries, or who might be older, or who might be a greater surgical risk, not so much so with the minimally invasive surgeries.
Yeah, and so like with TIF, for example, sometimes we can offer that to patients who have not had or have had significant abdominal operations that may preclude another type of operation.
Because they have a scarring, et cetera, and things that are keeping them from being operated on.
Yeah.
So, so I'm a patient. I've been, I have a hiatal hernia. I've got significant reflux. I come into your office to have this procedure. What sort of evaluation happens? How long does this generally take before I can have the surgery? And once I've had the surgery, what would I expect my recovery time to be?
Sure. So at our initial evaluation, you may come with a lot of workup already provided by your gastroenterologist or your primary care physician. However, I will need several different studies to document the severity of your reflux, and so those can be in the form of pH testing, or if you've have demonstrated severe esophagitis on endoscopy, you would need an endoscopy. Also, if you are considering certain types of surgical options like LINX, then I may require you to get a test called a manometry, which tests the strength of the esophagus. Because we're building up a new valve at the end of the esophagus, I need to make sure that your esophagus can overpower what we're going to put at the end so that we don't have trouble swallowing afterwards. And so the time frame for this to get all of the tests done between the patient's schedule and our schedule sometimes can be a few months, but we try to get people on the schedule as soon as possible. As far as the recovery afterwards, there are some distinct differences between some of the surgical options. Traditionally, with fundoplication and even the TIF surgery, a lot of times we start people out on a easier diet. So liquid diet and then pureed, or like mashed potatoes and soft foods, and that progresses up to regular food over about a 6-week time frame. However, with the procedure such as LINX, we actually encourage eating very early on because we want that magnetic ring to be stretched out while the tissue integrates into it.
Gotcha. And so, and so, if I come and have the surgery as a patient, and I was, taking off work, how much time would I generally have to take off work?
Most people are taking off between 1 and 2 weeks for these surgeries.
So I have 1 and 2 weeks. And how about insurance? Is this something that typically insurance covers, or is this a special surgical procedure that's not covered by insurance?
Yeah. When people have not had hiatal hernias previously, a lot of these other procedures, such as LINX or TIF, these newer surgeries, were not specifically covered by insurance, and we may have to work with your specific insurance provider to see if they are covered. But more and more, as we've been offering hiatal hernia repairs, that main code that we use to charge an insurer is everything that we do is bundled with that hiatal hernia repair. So we haven't been experiencing that.
Well, that's wonderful. So novel approaches to an age-old problem, providing us, with less invasive procedures, less recovery time, and just different, and basically less complications than the traditional approaches have taken.
That's right. So, a lot more patient satisfaction, people getting off of PPI medications or acid suppression medications, and having better quality of life afterwards.
That's wonderful. So now, if I'm interested, Dr. Kleppe, in terms of contacting you, how would I contact your office and where are you located?
Sure. Our office is located at the University of Tennessee Medical Center. You can contact us by phone, 865-305-9620, or visit us at website utsurgery.com.
And at utsurgery.com, is there additional information about these procedures, et cetera, if I'd like to read more about it?
Yes.
Wonderful. Well, thank you so much for joining us here today and giving us excellent information about how to approach reflux.
Thank you.
And with that, that brings this episode of Doc Talk to a close. Doc Talk is a podcast that's produced by the Knoxville Academy of Medicine that features its physician members giving information to patients to help their healthcare lives. I'm Dr. Rob Page, and thank you so much for joining us here today.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.